Angelman syndrome is a complex and often misunderstood condition. It's caused by a genetic mutation that affects the nervous system, leading to developmental delays, neurological issues, and other unique challenges. Let's take a closer look at what this syndrome entails. Angelman syndrome is a rare neurogenetic disorder that occurs in approximately 1 in 15,000 live births. It was first identified in 1965 by Dr. Harry Angelman, who noticed that several of his young patients shared similar symptoms, including severe developmental delays and frequent laughter. The syndrome is caused by a mutation or deletion on the maternal copy of the UBE3A gene located on chromosome 15. This gene is critical for normal brain function, and when it's not functioning properly, it leads to the symptoms associated with Angelman syndrome. Interestingly, even though the paternal copy of the UBE3A gene is present, it is typically silenced in certain parts of the brain, which is why the loss of the maternal copy has such a significant impact. People with Angelman syndrome often exhibit a range of symptoms, including severe developmental delays, intellectual disability, speech impairments, and problems with movement and balance, known as ataxia. One of the hallmark signs is frequent, uncontrollable laughter and a generally happy demeanor, which is why it was originally dubbed happy puppet syndrome, a term now considered outdated and offensive. Diagnosing Angelman syndrome can be challenging, especially because its symptoms overlap with those of other developmental disorders. However, a combination of clinical evaluations and genetic testing can confirm the diagnosis. The most common test used is called a methylation test, which can detect the majority of cases by identifying abnormalities in the UBE3A gene. Currently, there is no cure for Angelman syndrome, but there are treatments available to manage its symptoms. These include physical therapy, speech therapy, and occupational therapy to help individuals improve their communication and motor skills. Anti-seizure medications are often prescribed, as epilepsy is a common co-occurring condition. Despite the challenges associated with Angelman syndrome, individuals with the condition often have a normal life expectancy. With the right support and interventions, many lead fulfilling lives, enjoying strong social relationships and participating in various activities. There's a lot of exciting research happening in the field of Angelman syndrome. Scientists are exploring potential treatments that target the underlying genetic causes, including gene therapy, which could one day correct the mutation or reactivate the silenced paternal UBE3A gene. Clinical trials are ongoing, and there's hope that these advancements could significantly improve the lives of those affected. For families and individuals living with Angelman syndrome, support networks are incredibly important. Organizations like the Angelman Syndrome Foundation provide resources, advocacy, and community connections to help navigate the challenges of the condition. Raising awareness about Angelman syndrome is crucial, not just for supporting those who live with it, but also for fostering understanding and empathy in the broader community.